Hi, I'm Dr. Bryan Hendriks. Thank you for watching the channel. I got a really great question this week. Hey doc, I'm thinking about doing All-on-4, but my friend scared me because they said if All-on-4 fails, or if it doesn't work for me, they say I won't even be able to wear a denture. Tell me what you think about that. Is that true? In the process of doing All-on-4, we do have to do some contouring or shaping of the bone. And if we look at this, these are models that doctors have done when they've come to my courses. What we do is we take out these teeth, and there's the bone that's in between the teeth. It's scalloped, it goes up and down. And so what we do is we will flatten off that area to give it so the patient has a really cleansable environment to be able to clean. So on top of that, there is a certain required amount of space that we need to have, meaning that when we reduce the bone, you see here, there has to be enough space to be able to, there's a certain amount of space that has to be there. Otherwise, this bridge will be so thin that it also has a higher chance of breaking. So there's material thickness. That's one of the reasons why we have to reduce or contour bone. I don't like to reduce any more bone than I have to, but if you don't reduce enough bone, it can also have severe complications also. Let's just go back again. The patient starts off like this. This is where they're at in the surgery. We have one abutment on there that in the process of putting the abutment on, and this is where they're at now. They put 4 implants in there now and take off this lower jaw. We're gonna see here. So this is what it looks like. And what we have going on there is we have the implant in the bone, then there's a post or abutment that sticks up out of there, and then a bridge is made to screw down on top of that. Let's come back to this conversation about what happens when someone does All-on-4 and it doesn't work. What does that look like? It's not very often that we see patients lose all the implants. I would say in about 5 to 10% of patients, we're gonna have 1 out of the 8, depending on how many we put in. Again, 4 per arc, 4 on the top, 4 on the bottom, or 6 on the top, 6 on the bottom. We might have 1 implant not take. That's still pretty rare, but we just have to take the implant out and then replace the implant, and we're back on track. Like when we talk about All-on-4 not working, this person's referring to as a catastrophic failure where we lost all the implants. And this is why it's so important that before you even consider doing this surgery, you take the time to do a workup with your primary physician, have your blood checked, make sure that your body is in working condition so that if we put an implant in, that it's going to have a really great chance it's going to accept it. The patients that are at highest risk of implant failure are going to be someone that is a smoker, someone that is a uncontrolled diabetic, someone that is on a lot of medications for a number of issues. Oftentimes we see this in patients that are on chronic opioids, chronic narcotics, where they have back pain, or other patients that can be a little bit higher risk, or someone that's taking IV bisphosphonates. In the very end, what I want you to know is you don't have to be in perfect health. You just have to be very transparent with the doctor and make sure that they're aware of all the medications you're taking. This is not the time to try to hide something from the doctor. This is why we do workup. I make sure I get brand new blood work sent to me and their primary physician. We both look at it, make sure these patients, they don't have any underlying conditions. Sometimes, like for example, my dad, he's on a few medications and he's on a blood thinner. That's not gonna really affect the body to heal, but it changed the way we did the surgery. We had to do some juggling with his medications to make sure that he would coagulate, that he would actually stop bleeding. These are important things to know. Sometimes we have to give patients antibiotics even a week to 10 days before. Every case is a little bit different. The third patient that I think is a high risk is someone that is just negligent. This is the person that doesn't take any responsibility. We tell them to be on a soft diet and they completely disregard it. They eat and chew whatever they want. They don't do the hygiene. They don't do the maintenance we expect, where you have to clean around the bridge and the devices. And this is a grinder, someone that's like constantly stressed and clenching their teeth. You have all these pre-existing conditions, and you're someone that's not going to listen to instructions. You could be someone that has a catastrophic failure. So you definitely shouldn't do All-on-4 unless you're willing to take it seriously, because the doctor can do everything right and we still have a horrible outcome if you don't take responsibility. Let me show you what bone loss looks like. You can see the progression of bone loss as you get down. You see how the bone starts to go away? And when we put a denture on top of this, each time we go from here to here and then to here, what happens is there's less bone and we have to fill in more material. Like this is actually a reline inside there, and the added material. And every time we have to reline it, you end up having this to be thicker and it weighs more, so it has a bigger chance of falling out. Most of the time, people do pretty well on the top because of this. There's a palate. It means there's a stop. This big, huge surface area, you're going to have a better suction. So let me show you kind of progression of what the bottom looks like. This is someone that has their teeth, and you can see that when you start losing bone, the bone on the bottom oftentimes is lost a lot more because there's not as much. And we go from here to there, and then this is the one that's crazy, but literally you can have this much bone loss. If we look at this, when early on, you can put a denture on top of this, like this one here, and you can put a denture there. The denture is going to be retained by surface area, which equates to overall stability. The more surface area, the more contact, the more stable something is, and consequently also you're going to have more of a suction. On the bottom, because it's a horseshoe, it's much more difficult than on the top because the top has the palate. Even in the worst scenario here, look at the difference in bone. Because of all this you have here, that's a big difference. But let's say you have catastrophic failure and now you're here. Now you have to basically put a denture on. Now look, see how much surface area you have on this one, but you can see, look, how much surface area do you have that's going to be in contact here. So this is where you have to depend on a lot of denture adhesive. But you have to reapply it over and over again, and food's always getting up in there. And the last thing that's really bad about a lower denture when you have this much bone loss is that you end up, that nerve ends up being here, right on top. So when the patient is biting down and it's pushing on that, you actually have pain. But that is a big problem. But the lower is the highest risk of catastrophic failure when it comes to having to wear a denture. You can always wear a denture. It's just how stable the denture is going to be and how hard it's going to be to get used to it. Getting to this, that's something that is possible. It's like everything in life. If you do the homework and you put the time in, the chance of having a good outcome is going to be significantly better. But you do not want to ever lie to your doctor, not tell them that you're smoking or you're using a vape. Nothing in life is certain. No doctor should guarantee implants because they're not God and they can't guarantee it. In my office, we give the patients a break, that they didn't have to pay the full fee to have the implants replaced, but there was always a fee. That's what you have to understand, is that there's a risk. That's why you do your homework and make sure you find the right doctor. All is a fantastic surgery, but you do need to be qualified as a patient. The doctor does have to have experience to know when they're on a black diamond versus with the kitty hill. Thank you so much for watching my video. Make sure you subscribe, and we'll catch you on the next video.